Hello there and welcome to Yodo. I'm Dr. Sarah Bohn. This video is a continuation of the topic of connective tissue diseases. Today we're going to go over a few of the more well-known mixed connective tissue diseases. I'll give some specifics of the damage that can be caused by these diseases and what end-stage disease can look like. If you missed the introductory video to connective tissue diseases or the video about inherited connective tissue diseases, you can look back to those. Mixed connective tissue diseases are autoimmune mediated. These are not common diagnoses for a person to be receiving palliative care, but any one of them could be. Patients with issues from end-stage mixed connective tissue disease would benefit from an evaluation by a palliative specialist, as palliative care can assist with symptom management, provide suggestions for improving quality of life, and help patients and their loved ones have a better understanding of the disease process and the anticipated trajectory, as well as guide the goals of care discussions with the patient and their loved ones. These mixed connective tissue diseases can cause damage so severe as to result in damage to an internal organ system, and that will lead to the patient having a limited life expectancy. So when patients become eligible for hospice, it matters little that it's from a mixed connective tissue disease or from some other process. And I certainly have cared for individuals that have end organ damage caused by a mixed connective tissue disease during my career. Patients with mixed connective tissue diseases have some of the same symptoms as patients with other forms of connective tissue disease. Predominant symptoms including pain, joint swelling with progressive joint deformity. Gelling phenomenon and Raynaud's are also possible for these patients. Anemia is very common and for some can borderline on being severe. The state of chronic inflammation of some of these patients really affects their blood vessels and can certainly damage their internal organs. Nearly all patients will have a wide range of general complaints as well, including weakness, fatigue, poor sleep, depression, anxiety, appetite and weight issues, as well as abdominal symptoms, not limited to pain, cramping, bowel irregularity, but some will also have food intolerances and can also suffer from malabsorption. Other common symptoms include skin issues with sun sensitivity, skin thickening and scarring, rashes, and hair loss. You might think those are not really life-limiting symptoms, and that's true, but these problems impact a person's lifestyle and their daily choices. They limit their activity, and that will further impact their quality of life as well as possibly adding to their medical burden. Let's discuss some of the causes of mixed connective tissue disease. It's not all entirely known, but it's something that happens that causes the immune system to go awry. Possibly genetic, certainly can have an effect on this, but environmental causes also can contribute. The patient's immune system gets mixed up, activated, and begins to attack parts of their own body and inside of their joints. For some patients, there can be significant inflammation inside of the body, and that's ongoing. The inflammation can intermittently ease up a bit. For many patients, though, the inflammatory markers that are circulating in the blood are ongoing and have a continuous presence. The inflammation that's behind this damage is what's causing the joints and the internal organ systems to have problems. The organ system affected depends on the particular mixed connective tissue disease that the patient has. The causes for autoimmune dysregulation and resulting inflammation are not well understood. It can run in families, but not always. Environmental factors also have an impact on some of these diseases, but for many patients, the clear cause is not determined. And when a clear precipitating cause is not determined, that's called idiopathic. So most of these patients have idiopathic cause. Next, I'll go over the internal organ systems that can be affected. Because the immune system is involved with causing these types of connective tissue diseases, it's more likely than others to affect more than just the joints or the skin. A person's internal organs can be at significant risk, resulting in organ damage. The injury to the internal organ system affected is permanent, and the damage can be so severe as to lead to early failure of that organ system. Lung tissue can be affected, and scarring can occur because of the chronic inflammatory markers that's present in the circulation. Some mixed connective tissue disease patients will have trouble with breathing, and the issues from the scarring process can progress all the way to interstitial lung disease, which is a COPD-like process with the damage to the lung tissue, or pulmonary hypertension, where the stiffness of the lungs becomes so advanced and severe that it puts pressure on the heart and the heart valves. Lung stiffness can damage over time, not just to a person's breathing, because it becomes difficult for the heart to circulate the blood through the lungs, but the membranes can become thickened, and so it's more difficult for oxygen to transfuse through that thickened membrane. The abnormal thickening of the lungs can make the heart work much harder, thus aging the heart prematurely. The heart can be affected on its own, not just by the stiffness of the lung, but the valves of the heart as well as the muscle cells of the heart can be damaged on their own independently. The heart muscle can develop issues resulting in decreased strength and contractility. The heart can become weak and the muscle is not as strong, and it doesn't have the strength to squeeze the blood through and pump the blood around the body correctly. Other patients may have a stiffness to the heart, and the heart doesn't relax to fill correctly. Some conditions have a high risk for the valves to become affected. Heart valve issues can be leak or might be stiff and not open or close correctly. If the heart valve is leaky or stiff, a valve procedure can be performed, but the cause of that abnormality is still there after the procedure to fix that heart valve has been completed. In addition to these issues, the risk for heart attack is also increased in some patients with mixed connective tissue diseases, even though those patients might have normal cholesterol levels. For some mixed connective tissue disease patients, the kidneys can suffer terribly from the inflammation, resulting in impaired function, with the possibility of severe irreversible damage to the point that the kidneys fail completely and are unable to filter the blood, resulting in a person needing dialysis. The digestive system can have decreased function with poor motility. Bacterial overgrowth or impaired absorption can occur. The scarring and damage to the gut results in the impaired ability of the gut to prepare, process, and absorb nutrients, vitamins, or minerals correctly. Common deficiencies include iron, vitamin D, and certain proteins. Other gut symptoms that patients frequently have include heartburn, stomach ulcers, nausea, vomiting, constipation, or diarrhea. Nerve changes can occur in some patients. Peripheral nerves can be affected with the possibility for increased or decreased sensation as a result. For other patients, the central nervous system can be affected, and the patient might develop a seizure disorder, abnormal movements, balance issues, and a few patients can develop cognitive impairment and have early onset dementia with memory issues. Skin issues are very common for patients with mixed connective tissue diseases. Rash is a common feature for many patients. The rash might be subtle or more apparent. Sometimes it could appear red or raw or sunburn-like. The rash might be uncomfortable or outright painful, or have no sensation change or abnormality at all. The rash areas might be unpredictable in their characteristics and pattern, sometimes appearing quickly and yet fading slowly over weeks to months without much explanation or response to topical treatments. Rash sites, however, are very typically very near the previous locations, not generally migrating or spreading significantly from where that previous location was. The mixed connective tissue diseases that are autoimmune related that I will go over today include lupus, scleroderma, dermatomyositis, and polymyositis, Sjogrens syndrome, and rheumatoid arthritis. Likely you have heard of lupus. There are several varieties of lupus within this class, some being much more worrisome than others. It is known as the great imitator, as the symptoms can vary considerably and may overlap and mimic other connective tissue diseases, as well as appear like an unrelated disease process entirely. Lupus is well associated with a rash. There's a typical butterfly-shaped rash across the cheeks and that goes across the bridge of the nose. Symptoms of lupus are similar to many other connective tissue diseases with joint pain and swelling. Most patients have typical symptoms of fatigue, intermittent fever, headache, and dry eyes. Some lupus patients find that sun exposure may trigger a flare-up, but having an infection or starting a new medication or having some emotional or environmental stressor could also result in a flare-up. Nearly 80% of patients with lupus can anticipate a normal lifespan, but for others, there is a risk of damage to internal organs. For some patients with lupus, they can have significant impact on their health to the point of shortening their lifespan quite a bit. Lupus has a really bad reputation. The lupus autoimmune issues can affect internal organs and damage them permanently. The organ system most often at risk for lupus patients is their kidneys. It is one of the more worrisome connective tissue autoimmune diseases because of the potential for advanced vasculitis damage occurring. Vasculitis is the inflammation of the blood vessels and their lining. There's a potential damage to the kidneys because of the vasculitis that lupus can cause. Permanent damage to the kidneys can occur at a very young age. Kidney damage can be severe, as we've said, and may lead to dialysis. And if this form of the disease is what's occurring, that damage can occur very early in life. Some studies estimate that 4% of the people on the kidney transplant list are lupus patients. Lupus nephritis almost always affects people between the ages of 20 and 40, and for some, as I said, sadly, it's a very young person can experience this most aggressive form of lupus. Their life expectancy overall is generally shorter. Currently, life expectancy for someone with lupus is in the early to mid-60s, and that's anticipated because of the inflammatory damage that is caused by these vasculitis-related issues. More than 80% of patients with lupus are female. Lupus patients must be disciplined with their lifestyle choices and their healthcare follow-up. Dermatomyositis, Scleroderma, and Polymyositis are all somewhat similar mixed connective tissue diseases. Each of these has a specific set of characteristics with a little bit of overlap on some of the others. They affect the skin and muscles. Inflammatory and degenerative changes of the skin and muscles occurs most commonly. Polymyositis more typically involves muscles. Dermatomyositis involves the skin, and Scleroderma overlaps a little bit with both of those. Dermatomyositis has similar joint aches and pains as other connective tissue diseases, but primarily results in skin problems such as atrophy and skin adhesions. Scarring of the skin can lead to contractures. Nail changes are not uncommon, and patients can have swelling in atypical places. Episodes of Raynaud's is very common. Scleroderma has overlap with dermatomyositis and polymyositis. Scleroderma affects the skin and muscles. The skin becomes thick, scarred, and shortened. It's actually like it's almost hard to the touch. Scleroderma typically affects the muscles inside the gut, resulting in digestive issues. It affects muscles inside of the blood vessels, causing circulation problems. It can affect the skeletal muscle as well as the smooth muscle, though. The connective tissue around the muscles becomes scarred, so it can affect the heart, because the heart is one large muscle. The immune system thinks that there's an injury, and it produces too much collagen. Because of the inflammatory mediators that are involved, the immune system is convinced that more collagen is what is needed, and so it will begin to produce way too much. Polymyositis is the next one I'll discuss. Typically, these individuals will have a red or purplish rash. For most patients, it will affect the muscles of the trunk and the larger limbs. Muscle tissue can become inflamed and over time begin to break down, resulting in movement issues and weakness. Muscle pain and tenderness come in conjunction with that weakness, and it's most common in the pelvic girdle and the shoulder muscles. For most patients with any of these three, it is not very common for there to be a high risk for severe end-organ damage. These diseases more commonly will cause chronic muscle discomfort with weakness, digestive, and skin issues. The next mixed connective tissue disease we're going to discuss is Sjogrens syndrome. These folks are often plagued by a triad of symptoms of dry eyes, dry mouth, and the joint inflammation of rheumatoid arthritis. Nearly 90% of patients with Sjogrens are female, and the typical age of onset is early 40s. Dry mouth can contribute to difficulty with swallowing and certainly issues with speaking, but it can also lead to early dental breakdown. The severe oral dryness results in poor dental health, and there can be significant risk for premature dental loss. There's an increased risk for infection in the gums or dental caries. So oral infections, as we know, carry a higher risk for the possibility of that infection getting directly into a person's bloodstream, and then that can lead to other worrisome health issues. Scarring of the connective tissue over time is typical for Sjogrens patients. The tissue becomes thick, with progressive damage, limiting organ function. Muscle and joint movement is reduced with resulting stiffness and decreased strength and decreased movement. Sjogrens typically is slowly progressive over many years. Life expectancy for most patients is not adversely impacted. However, some patients with aggressive forms of the disease can have internal organ involvement and have an increased risk for havoc being wreaked onto their health in other ways, whether it's premature heart disease, premature lung disease, but other organs can be affected in Sjogrens. Sjogrens also carries an increased risk for some malignancies. It's been associated with lymphoma, and some studies show an increased risk for multiple myeloma. Again, routine health care and healthy life choices are advised. The last mixed connective tissue disease I will discuss is rheumatoid arthritis. This one is probably the most well-known of this group. Significant joint damage of the hands is very common. Joint damage and distortion occurs over time as the body's immune system attacks our own joints. There are characteristic deformities that occur in a particular set of joints, and these deformities can be quite obvious in some patients. Nearly any joint can be affected, but in particular, the joints that are most often affected is the proximal interphalangeal joint, the PIP, and the metacarpal phalangeal joint, the MCP, and then of course the wrist joints. You likely have seen someone with these joint changes and wondered what happened to their hands, but there's the swelling of these joints as well as ulnar deviation where the fingers will tip toward like the elbow side of the hand. Shoulders, hips, elbows, and knees can also be involved. And I've cared for many patients over the years with rheumatoid arthritis, some with significant pain and minimal joint abnormalities, and then others on the opposite end of the spectrum with minimal pain and significant joint distortion. There can be tremendous progression with irreversible deformity of these joints that occurs over time. And for some, even with good treatment response, it may only slow the changes and the damage still occurs. As with other connective tissue diseases, rheumatoid arthritis can affect more than just the joints. There are multiple organ systems that can be affected by rheumatoid arthritis. The skin with development of nodules or rashes, osteoporosis due to the body being in a chronic state of inflammation, the bones can show signs of aging too early in life. Eyes can be dry and lead to scarring of the cornea. Dry mouth with resulting outcomes similar to that of Sjogrens patients. Lung scarring from the inflammation that circulates and damages the internal network of the lung tissue occurs in almost 80% of rheumatoid arthritis patients, and it's rheumatoid lung. It results in that scarring and the lungs becoming stiff. And then the lungs, when used inhalers like of an asthma person or patient with COPD, the lungs don't respond because it's a different disease process. Heart and circulatory system may be injured by the ongoing state of chronic inflammation. Premature heart disease and diabetes are risks for patients with rheumatoid arthritis. The inflammation reactants that the body puts into the bloodstream can lead to the lining of the blood vessels becoming irritated and more likely to absorb cholesterol, and early plaque formation can occur. This translates into an increased risk for heart attack and stroke. So their cholesterol level may not be high, but the cholesterol they have can lead to premature atherosclerosis. These events can result in small, multiple injuries that just add up over time, possibly weakening the heart or leading to early cerebral atherosclerotic disease in the brain with possibility for vascular dementia. Although these connective tissue diseases are chronic illnesses and progressive, there are medications that are available to treat each of these. The rheumatologist will tailor the treatment specifically depending on the disorder and that individual patient. There isn't really a curative measure available, I want to say yet, at this point, because we are getting new medications and having advances all the time. So treatment right now is an ongoing process. These medications do modify and change the course of the disease, so they are definitely worth looking at, talking with rheumatologists, and for most patients, it's definitely worth for them to take these medications. Patients still likely will have pain issues and will need to have this problem addressed as well. Ideally, managing the disease will arrest or slow the process, possibly eliminate or reduce the discomfort that's involved, but not for every patient. So it's an ongoing battle and an ongoing healthcare need for these patients. You can see how these are not easy as far as diseases to diagnose or to treat, and certainly not easy illnesses for a person to have. Rheumatologists are keenly aware of the risks associated with each of these disease processes, and when they tailor the treatment for the patient, they will keep all of these things in mind and provide full disclosure about risks of the medications. The effects of connective tissue disease on internal organs varies by the disease form and its severity. Fortunately for most patients, this disease group does not adversely affect a patient's life expectancy. Unfortunately, each of these disorders does cause issues with pain, limited mobility, and that will affect the patient's quality of life. For some patients, end organ damage is at higher risk and it can shorten their life. Patients often will have to have several physicians that care for them. They're going to need care from their primary physician, rheumatologist, and possibly a specialist or two to manage any damage that's occurring to that end organ, whether it's the heart, lungs, or kidneys. Having a severe medical issue is like having a part-time job that you don't really like. If you have any of these connective tissue diseases, good self-care, regular health maintenance are musts. Keeping good health habits, making wise choices about food that promotes good nutrition, and care for your GI system are also important. Do what you can to stay at a reasonable weight and stay active, safely active. Protect your joints and ensure ongoing optimal range of motion of your joints. Protect your skin from the sun and be kind to your skin by limiting harsh chemicals, keeping your skin clean and well moisturized. Keep your doctor's appointments, and if you're not able to follow all of the physician's recommendations, you must let them know and find out what other options you might have. If you have late-stage connective tissue disease, you might have anemia with fatigue and weakness, GI issues with weight loss, bowel irregularities, or pain. You can request a palliative care evaluation to assist with symptom management, improve your quality of life, and learn more about the disease prognosis and trajectory. When end-stage disease occurs, hospice can help tremendously by reducing suffering, managing symptoms, and helping to promote the best day every day. At the end of life, due to debility, weakness, poor appetite, and difficulty tolerating the medications to treat the connective tissue disease, many patients do abandon those medications because now they just want to really focus on comfort. This was a really long series, and I'm proud of you for making it through all 3 of these videos. If you have a topic that you would like to discuss or a question, please drop it in a comment below. Thank you for your time. Go take a nap now and rest your brain. Bye.